Good day. Today I would like to discuss the practices in the construction, the occupational health and safety, minimum acceptable standard in the construction by Safety Corner. So let's go. So the content of these topics is COVID-19 prevention and awareness. Number 2, hole protection leaf shop. Number 3, hole protection risers and penetrations, edge protections and guardrails, housekeeping, temporary electricity supply. Number 7, portable electric power tools. 8, compressed gas cylinder and accessories. 9, ladders and step ladders. 10, firefighting equipment. 11, suspended access cradles and platforms. 12, abrasive wheels and power tools. 13, hot works. 14, mobile scaffold towers. 15, excavation. 16, control of substance hazardous to health. Lifting accessories. Concrete buckets. Mobile elevated work platforms. Traffic controls. Lifting operations. Cranes. Electric earthing grounding. Underground and overhead services. Guys, I included the COVID-19 prevention and awareness on these presentations to give additional knowledge on the prevention and awareness for the COVID-19. So this is to make it ourselves safe due to the knowledge. COVID-19, an acronym for coronavirus disease 2019, a mild to severe respiratory illness that is caused by coronavirus. It is transmitted chiefly by contact with infectious materials such as respiratory droplets and is characterized especially by fever, cough, and shortness of breath, and may progress to pneumonia and respiratory failure. The myth: the new coronavirus affect older people. The fact: people of all ages can be infected by the new coronavirus nCoV 2019. Older people and people with pre-existing medical conditions such as asthma, diabetes, heart disease appear to be more vulnerable on this COVID-19. Our source, World Health Organization. What is infectious disease? Infectious disease transferable to other by human beings or by animals, insects, foodstuffs, places or other things and substances contaminated by the microbes and toxins of the infectious disease, also known as communicable disease or contagious disease. So when we said communicable or contagious, it is transferable to any rapidly transferable to other people. Pandemic. What is pandemic? Pandemic, a worldwide spread of new disease. An influenza pandemic occurs when a new influenza virus emerges and spreads around the world, and most people do not have immunity. So as of this time, coronavirus cases 107 million, death 2.3 million, recovered 79.9 million. So the active cases, as per the data that we got from the web for coronavirus monitoring, 25.4 million current infected patients, 25.5 in mild conditions, 99.6%, or 101,000 serious or in critical conditions of 0.4%. Prevention. What is the prevention? The outright avoidance of adverse impacts of hazards and related disasters. So, the myth, regularly rinsing your nose with saline help prevent infection with the coronavirus. The facts, there is no evidence that regularly rinsing the nose with saline has protected people from infection with the coronavirus. Self-quarantine. What is self-quarantine? To refrain from any contact with other individuals for a period of time, such as 2 weeks, during the outbreak of a contagious disease, usually by remaining in one's home and limiting contact with family members. Here is an example of how the incubations and exposure timeline works. Bob was exposed to COVID-19. On day 0, Bob was exposed to COVID-19. On day 5, Bob got tested for COVID-19 and the results came back negative. So, when you are exposed to COVID-19 on the day 0 and at the day 5, it might be your COVID-19 test is still negative. On the 8th days, thinking he did not have COVID-19, Bob went to work and a family gathering. He was contagious days 8 and 9, 48 hours before the symptoms, and now exposed to 22 people. So on the 10th day, Bob became symptomatic and tested positive. Imagine, from 0 to 10 days, only on the 10th days, he got symptoms on the COVID-19. So if you are exposed from someone confirmed with a COVID-19, so you need to isolate yourself because it will not immediately show that you have a COVID-19. It looks like 0 to 10 days, that time you will get the symptoms for the COVID-19. So that's why it's very important the incubation, follow the incubation timeline up to 14 days incubation period. Next, what is incubation? Incubation period of COVID-19 disease is between 2 to 14 days. This means that if a person remains well 14 days after contact with someone with confirmed coronavirus, they have not been infected. Myth, the incubation period is up to 5 days. Wrong. Fact, the incubation period means the time between catching the virus and beginning to have the symptoms of the disease. Most estimated of the incubation period for COVID-19 range from 1 to 14 days. Transmission, how this virus transmit to another person. First, person to person who are in close contact with one another within about 2 meters. Respiratory droplets, cough or sneezing or speaks. When someone is speaking, you can inhale the respiratory droplets, or by someone coughing or sneezing, you can inhale the respiratory droplets within 2 meters, or you can touch by hand the respiratory droplets from the things around you, and you will get touch on your mouth or nose, because the entry point on our body is our mouth or our nose. Myth, COVID-19 is an airborne disease. The fact, COVID-19 is not airborne and is mainly transmitted through droplets generated when an infected person coughs, sneezes, or speaks. Myth: mosquito bites get one infected with COVID-19. The facts: COVID-19 doesn't spread from mosquito bite, but through droplets spread when an infected person sneezes, speaks, or coughs. Myth: I can catch COVID-19 from my pet. Fact: while there has been one instance of a dog being infected in Hong Kong, to date there is no evidence that a dog, cat, or any pet can transmit COVID-19. World Health Organizations. Common symptoms: fever, 99%. That means you have a very heavy fever, and you have a fatigue feeling, 70%. You have a 70% feel you are fatigued. A drop cough of 59%. So if 59%, sometimes you are coughing, and sometimes it's not and not continue. And you are losing your appetite, 40%. So your appetite lose 40%, or that means you can eat but no taste of all food that you are eating. Body aches, you feel aches on your body, 35%. So why you are feeling aches? Because of this COVID. And shortness of breath. So that means your breath is, you are like running, so you have a short breath of 31%. And mucus or phlegm about 27%. You have still phlegm, but only 27%. Symptoms usually begin 2 to 14 days after you come into contact with the virus. Other symptoms: sore throat, headaches, chills, sometimes with shaking, so you are shaking even you have a good blanket. Loss of smells or taste, so as I told before, loss of appetite. Congestion or runny nose, so you cannot breathe easily. Nausea or vomiting. Diarrhea, so you feel uncomfortable in your stomach because the virus is going to your stomach. And emergency symptoms: trouble of breathing, so you cannot breathe easily. That is emergency. Constant pain or pressure in your chest, you have a pain or pressure in your chest. Bluish lips or face, and sudden confusion. If you get these symptoms, that means it is emergency, so call emergency services right away if you have one or more of these COVID-19 symptoms, and follow their advices. Diagnosis: how we can diagnose this COVID-19. So as a review only, a swab test or PCR test. Okay, they will get sample from your nose or from your throat. DPI test, blood laser rapid test. They will get blood from you, and they will put into a laser to test. If you get positive on DPI test, it is 100% that you have COVID-19. Okay, but so you need to get the swab test if you get positive on the DPI test. Okay. Treatment: vaccination. So in the treatment, there is available Pfizer, Moderna from Russia, Sinopharm from China, AstraZeneca from India at the moment. But you need to consult your doctor what is best suit for you, so that to avoid some allergens. And another one is good nutrition to boost our immune system to fight the virus. If you have a good immune system, it will fight the virus naturally. The meat, antibiotics effective in preventing and treating the new coronavirus. The fact is no, antibiotics do not work against viruses, only bacteria. The new coronavirus 2019 nCoV is a virus, and therefore antibiotics should not be used. However, if you are hospitalized for 2019 nCoV, you may receive antibiotics since bacterial co-infection is possible. Meat, an old Chinese doctor had found a cure to coronavirus, one bowl of garlic. Fact, there is no scientific evidence to this study. A viral post on social media claims that the bitter gourd, Karela, in juice can treat coronavirus. Fact, there is no such treatment. Meat, coronavirus gets automatically destroyed in high temperatures. Given its novelty, hasn't been proven yet if it gets destroyed in high temperature or not. Preventive measures must be followed until any further information is confirmed. Meat, the virus survives a few hours. Studies suggest that coronavirus may persist on surfaces for a few hours or up to several days. This may vary under different conditions. Example, type of surface, temperature or humidity of the environment. Source, World Health Organizations. Prevention. So, in the construction, we shall develop our emergency management plan and risk assessment. Follow government procedures on dealing with coronavirus and preventing coronavirus. Information. So, keep informed every single person in our organizations, in our family, and communication should be sufficient for them to get better understanding how to prevent coronavirus. Social distancing, so make sure we are avoiding the gatherings. Maintain at least 2 meters minimum from any persons that you want to talk or to meet, and as much as possible don't get engaged in the gathering or meeting someone if not necessary. Personal hygiene, make sure that we are always washing our hands properly with soap, and at least 20 seconds washing our hand to kill the virus if we touch the virus, and change our dress before we enter to our home. It's better to go to the bathroom and go with shower. So I would advise, so maintain our personal hygiene will prevent or minimize the exposure to coronavirus, especially those people around us. Disinfection of common areas, like for example the door handle, disinfect on this, because everybody is touching the door handles in the sink, the bathtub, the faucets, everything in your home that common. So disinfect on this regularly. So we remember that coronavirus may stay a few hours or several days in it's depend upon the condition of the environment of the things like metals. So it is always better to disinfect regardless of its characteristic metal characteristics. Okay, treat everyone around us as infected. So if you are treating everyone, especially those you don't know where he is going or coming from, you are keeping yourself at least 2 meters distance from him to anyone, and you are avoiding to touch anything or that he touch, or you are wearing personal protective equipment against him, so you are preventing the virus to enter to your body. Personal protective equipment such as mask, shield, and gloves. So proper use of mask is very important, and face shield, yeah, if you, I would suggest to use as well. Hand gloves, or also you can still use, but there is limitation. Remember that personal protective equipment, there is also limitations. So it's always better avoid meeting someone, uh, but if not, then you need to follow all this emergency protocol. Better develop emergency management plan and risk assessment, how to prevent the risk of getting coronavirus. Here are some practices that we are doing in the construction. So the bus, we reduce the capacity of the bus, okay, by single file for every row of the chairs of the seat, okay, inside of the bus. And we are conducting the meeting outside, so that the coronavirus, if there is someone have coronavirus, it will go out on the surroundings only, not inside of the room. And social distancing, previously the capacity of one tables is around 10 persons, 5 on each bench, but we reduce it into 4. If you have more benches, you can also use, you can only reduce up to 2 persons only for your bench, but if not, do it. But you can also reduce the manpower by stagger their shifts, so that you are reducing manpower in every shifts. Okay, so for the line, so make sure that they are following the lines with a safe distance from each other. Meeting for the office staff, do the meeting outside instead of indoor. So do it outdoor meeting, as you can see as well there in the construction, and making thermal scanning every morning before your labor entering to your workplace. Make sure that your dining room are clean all the times. Then social distancing on the resting area, regular disinfection of your buses with a approved chemical disinfection. Disinfection of our offices and site. Proper disposal of the used surgical masks. Make sure that we are teaching our workers on this regard, to make sure that every used mask place it in the proper waste bin. removing the finger scanning for the time in and time out, using the facial recognition machine for the time in and time out, putting some gel, okay, disinfection gel, sanitizing gel on the common areas, so that you can use it immediately when you in the times that you need it. Hand soap for the laborers in their common areas, disinfections of the tables and the toilets, hand soap. So remember that we are handling maybe around 3,500 laborers, so it's very costly to get the hand soap individually. So it's better to make a system that everyone can reach, the soap can reach them all the times when they are needed. And posters, like informative posters for COVID prevention, as you can see in the pictures. On the notice boards, posters of notice boards from the government, from your company, or your site practices, and your emergency response teams on the access. Guys, when you are putting the posters, and even the laborers, every time they can see it, so this is we call subliminal indoctrination. So every time you are seeing it, you are hearing it, then you will remember it. So it's very important that you have enough posters at sites conspicuously installed, so that the labor will be always reminded about the COVID-19 prevention. At the same time, this is requirements from the authorities. We must keep on protecting each others by sanitizing our hands and using the face mask and a space between each other. So I will show you one video on how the face covering and mask to minimize droplet dispersions and aerosolization. This is done. Sorry. So please watch. So no mask. As you can see, no mask. Someone is speaking how his respiratory droplets or saliva spread on the air. And on the top right, one layer mask. When someone is coughing, no mask. Yeah, no mask on at least you can see one layer of cloth mask. There is still going outside respiratory droplets. Cloth mask layer 2, sneezing. So this is the comparison of surgical mask and cloth mask. So even 2 layers of cloth mask, you can still see the respiratory droplets coming outside. In the surgical mask, still there is, but limited. Okay guys, I want to show you the hand gloves. This augmented reality. Scientists developed the software for their research to show study participants how well they wash their hands. They cover the user's hand in a ultraviolet fluorescence. There is always saying prevention is better than cure. So that's it for our COVID-19 presentation. So if you have any comments, please drop your comments. And as I said, this is only additional knowledge for all of us, but you just keep research in the Google or in the government from where you are belong. They will give you an update what is going on about the COVID-19 prevention. And as this time there is already COVID variants, so always listen, watch from the advertisement from the local government, local authorities, so that we can prevent this virus to spread from ourselves to our family, to our neighbors, to our colleagues, to everyone around us, and let us fight this COVID-19 together. Thank you.